So I'd like to thank you very much for coming here, and I'd like to thank my panelists, Dr. Shanahan, Professor Phantom Vanit, and Professor Balaji for joining us this afternoon. Our program, largely about dental volunteerism and service, really fits within the overall goal of the conference, in terms of integrating the multifactorial approaches, providing service to those in need is certainly one of those approaches we need towards the prevention of oral cancer, caries, periodontal disease, and other oral diseases. So the learning objectives for this afternoon are really threefold: to describe the global burden of disease and the need for oral health volunteerism, to understand the personal, professional challenges and preparations in becoming a member of a volunteer team, identifying appropriate clinical, social, cultural, and emotional skills for program sustainability, and also to appreciate the need for regulatory compliance, sustainability, and evaluation of an oral health project. We have 4 speakers this afternoon. Each speaker will speak for about 20 minutes each, and then we will be followed by a panel discussion and a Q&A. I want to thank all our speakers who come from all parts of the globe, because the one bond we have in common is that we're all fellows of the Academy of Dentistry International. The Academy of Dentistry International is a society founded in 1974 dedicated to advancing the science and art of dentistry for the improvement of oral health and quality of life for citizens of every nation. Currently, there are approximately 3,400 fellows in 86 countries. The Academy of Dentistry International differentiates itself by advocacy for sustainable oral health concepts. We believe in working with communities to build long-term relationships that can provide sustainable programs in both health and education. The ADI is unique amongst oral health organizations in that it is the only organization to be affiliated to the United Nations. Many health organizations affiliate with the World Health Organization, which is a good thing to do as well. The ADI is the only one currently in affiliation with the United Nations Department of Public Information and is about to become affiliated with the Economic and Social Council. The work of the UN with regards to health is really through the Sustainable Development Goals, of which there were 17 that were approved in 2016 by the General Assembly of the United Nations. Obviously, the third goal, good health and well-being, is the one that most aligns with all of us here today. However, the underlying rationale behind the Sustainable Development Goals is that you can't really succeed in one goal unless you succeed in many others. And of the 17 goals, goal 1, 2, 4, 6, and 10 probably most apply to us if we're going to improve health for the people on this planet. No poverty, zero hunger, quality education, clean water and sanitation, and reduced inequalities. Of the 17 goals, that if you want to find further about them, if you just Google Sustainable Development Goals or SDGs UN, you will find all 17 of them there. So to move on to the first presentation of the afternoon, Global Burden of Disease, Volunteering and Social Responsibility, we're going to look at the global burden of oral diseases. Many of us, no doubt, in preventive dentistry are very up to date with the publications around the global burden of disease study. However, many dental professionals around the world know very little about this and are totally ignorant. In some ways, that's not surprising. If we look here at a piece from a column of the American Dental Association news publication. It attracted about 7 centimeters on page 19 and just mentioned that untreated oral conditions rise to 3.5 billion. So really, the question is, what should the dental profession know? And that if we don't know, why is it that we're probably not winning the war in terms of preventing oral diseases? So as background, the global burden of disease study is latest publications relate to the year 2015. The Institute of Health Metrics and Evaluation at the University of Washington are the lead institute for the study, and it's mainly funded through the Gates Foundation. It is a very large undertaking involving some 2,300 independent experts in over 127 countries. It's tracking 315 diseases and injuries in 195 countries, and the data enables comparisons through the years 1990 to the latest reports for 2015. The reports relate to prevalence of disease, and then through an analysis of disability, look at things called disability-adjusted life years, or DALYs, or years lived with disability. For the sake of simplicity and the time we have this afternoon, I'm just going to review some of the top-line prevalence data for oral diseases. So the latest report was published just recently and related to 2015. And yes, indeed, oral diseases affect 3.5 billion people on this planet. That's about 48%. And the most staggering news is still that oral conditions, mainly preventable oral conditions, hold the 1st, the 6th, and the 10th most places for the most prevalent diseases on the planet. So dentistry, preventive dentistry, is actually responsible for 3 diseases in the top 10 most prevalent diseases on this planet. Is that shocking? Is it surprising? Are we embarrassed? Can we do something about it? Well, if we look a little bit deeper into the data, first of all, let's look at untreated caries. This is just the D component, cavitation into dentine, yeah? Not white spots, cavitation into dentine. Untreated caries in adults, in permanent teeth, is the single most prevalent condition on the planet, affecting some 2.5 billion people, or a prevalence of 34%. If we look at deciduous teeth, it's the 10th most prevalent of all diseases on the planet, affecting some 573 million children. Staggering amounts of untreated disease that we know is largely preventable. If we look at severe chronic periodontitis, this is not gingivitis, it's not early or moderate disease. Severe chronic periodontitis, CPITN score of 4, or a clinical attachment level of a clinical attachment loss of 6 or more millimeters, we know that the prevalence is some 7.4%, or affecting some 538 million people around the globe. And then finally, if we look at total tooth loss, edentulosum ranks 36 as the most prevalent condition, affecting some 276 million people, or about 4% of the global population. So we own 1, 6, 10, and 36 of the most prevalent diseases. If we look at that in terms of economic impact, it's estimated, Listel and others estimated, that the direct treatment costs alone amounted to some $298 billion, 82% of which falls in high-income countries, and it amounts to about 4.6% of global health expenditure. The indirect costs, the costs, lost wages, lost opportunity at work, children away from school, amounts to an estimate of some 144 billion. And that indirect cost of 144 billion places the indirect cost of dental diseases within the range of the indirect costs of the 10 most frequent global causes of death. And yet the diseases we're talking about are largely preventable. So the total global economic impact of oral diseases is estimated at some $442 billion a year. Imagine if we were just to reduce that by 10% or 20%, the amount of health resources that could be put into the diseases that seriously affect disability and quality of life. So we've got this vast prevalence where we're in the top 10 of 3 diseases. We're spending some $440 billion a year. We're ranked amongst the indirect costs of the 10 leading causes of death. How do we as a profession feel about that? Should we be ashamed of ourselves? Should we be embarrassed? Or should we actually be pleased with it? Could it be worse? Well, the problem is that since 1990, since this data has been tracked, there's been very little change whatsoever. Those rankings remain much the same. Yet, in fact, the total burden of disease has increased to include about another billion people with oral diseases, because the number of people on the planet has grown and the number of years that we're all living has grown. Therefore, the total burden itself has grown. So why is there such little change? Why we're all working hard every day, 5 days a week, 6 days a week, working all the hours we can? Why are we making no progress? Is it the dominance of the reparative model of treatment for disease? Is oral diseases sidelined by resources that other conditions have with more effective advocacy? Are other diseases better at getting resources than we are? When we talk about advocacy and policy, maybe we're under-resourced. Perhaps we don't bring all the constituents and stakeholders along that people competing for those same resources do. So where is the patient who suffers the oral disease? If heart disease or cancer want funding, they take the patients with them. They take the people that care for the patients at home. We tend to go in just as the dental profession. We won't even take the dental hygienists in with us. We want to do the talking as the dental profession. And maybe that looks to some degree of self-interest in the profession. The ministers of health know we're going to ask for more money, we want more dental schools, we want better pay, we want this, that. We don't have the emotive reasons of people who suffer the disease. We don't have that mother of the 3-year-old child that had a general anesthetic yesterday because of early childhood caries. We don't have the granddaughter of the grandfather who choked to death yesterday because of oral disease. We talk in terms of DMFT scores to 2 decimal places. We measure millimeters of gingival loss. We measure bleeding points. They don't tug on the heartstrings of those that really manage the healthcare systems. And finally, I'd say, who teaches prevention? Looking at the people here today at the conference, it's a world conference, but it's not one of the largest world conferences that I've been to. So is it that we're failing to prevent, we're failing to teach? And are we ignoring that ethical mandate, or just plain ignorance that these diseases are preventable? So there are many things that the dental profession should know. We need to be better at advocacy. We need to be better at competing for limited resources. And there's an opportunity for us to provide service, volunteerism, and social responsibility to help those communities that are under-resourced to actually get some of the services that in many countries we regard as normal. So that really sets up the opportunity for what we're now going to focus on, which is that opportunity for service and volunteerism and social responsibility. One other sideline I'd just like to note, there are many, many displaced persons on this planet today. The United Nations would estimate there's some 800 million people on the move, through being displaced or refugees or migrants. And that total number of displaced people is about 1.8 billion people who are displaced from their country of origin. Many of us in dentistry also move between countries, and I'm one of those people too. But there's tremendous migration of health workers where they're moving from countries where there's generally huge need for treatment, going to more affluent and wealthier countries. And that migration is shown here for oral health professionals in the FDI's Oral Health Atlas. So in summary, I'd like to say that oral diseases which are largely preventable place a disproportionate burden on humanity, both in terms of disability and in economics. The professional manpower we have to take care of those diseases is inadequate, both in the total numbers of healthcare professionals and how they're distributed on the planet. So that sets us an opportunity for an integrated approach to oral health. We can work towards in an integrated way with other NGOs towards the Sustainable Development Goals. Again, Goal 3 is the one for health, but I believe 1, 2, 4, 6, 10, and probably 17, which applies to everything, should be those that we focus on. We hear more and more talk about oral diseases becoming part of the NCD Alliance and the push for that reduction in non-communicable diseases on the planet. And maybe one of the solutions is this voluntary service to others, or dental volunteerism. So with that, I'd like to move on to our second speaker this afternoon. This is Dr. Simon Shanahan, talking about volunteering, personal and professional considerations, deciding if it's right for you. Simon Shanahan has been a fellow of the Academy of Dentistry International since 2000. He's the Vice-Regent for the Academy for the Australasian section. He has been in general dental practice for over 30 years and has been volunteering for the last 20 years. And he's done missions in countries as diverse as India, East Timor, Australia, Thailand, and Zimbabwe. And with that, I'd like to welcome Simon to come to the podium and share his experiences with us. Thank you very much, Simon.